further ado, you can all join me in welcoming our first presenter, Dr. Foster, who is going to be talking about integrating conflict management training in medical education, a systematic review for professional growth. Welcome.
Okay. Good morning, everyone. So our systematic review explored the literature on conflict management training in medical education, given that these skills are integral to patient care, effective team management, and sustaining engaging work environments. So however, there is a lack of consensus whether these skills and the curriculum should be taught in medical education. So I do not have any financial relationships to disclose. I am a member of Physician Just Equity, which is a nonprofit organization. They financially supported some of my expenses to attend the conference. So this presentation will provide a brief overview of our preliminary findings. I'll also briefly discuss how conflict management influences physician well-being, review some key skills for handling conflict, and define how constructive conflict can strengthen relationships. So the research shows a clear link between negative workplace relationships and increased burnout, which highlights the importance of conflict management skills. As healthcare professionals, we can face conflicts with colleagues, interdisciplinary team members, and patients. So perhaps you can think of a time you had to navigate a conflict during your training. So conflict management is crucial in healthcare, yet there isn't a standardized curriculum or a consensus to teach and integrate these essential skills in medical education. This is even though through leadership and conflict management, there are global medical frameworks that recognize that importance. So the CanMed's Physician Competency Framework, the American ACGME Core Competencies, and the UK's Medical Leadership Competency Framework. So early training could be beneficial to improve team dynamics in the hierarchy of physician training. So we conducted a systematic review of the literature in the last 10 years following PRISMA guidelines using the databases seen on the screen. From an initial 434 articles, they were narrowed down to 26 studies that met the inclusion criteria. So 20 out of the 26 studies occurred in the US and 1 in each of the other countries seen here. And nearly half of the studies trained undergraduate medical students or graduates. The number of participants varied, and some studies occurred longitudinally and integrated their findings over multiple academic years. Some studies also integrated topics like leadership, emotional intelligence, interprofessional care, and professionalism and medical improv into their curriculum with conflict management, while 38% did not. And 18 of the studies included role play or simulation sessions in their design. So the didactics and discussions covered the impacts of constructive and destructive conflict on patient care and safety, where you can see on the screen here the definition for constructive conflict. This encourages diverse viewpoints and fosters a collaborative approach, and destructive conflict can harm team dynamics and negative impact to patient outcomes. So some of the studies offered self-assessment through standardized tools according to their areas of focus. And one tool, such as the Thomas Kilman conflict instrument, that's specific to conflict management. So 13 studies use this tool to help their participants understand their natural tendencies in conflict situations. So the tool has 5 conflict handling modes, as can be seen on the screen. Each one represents a different approach to handling conflict across dimensions of how assertive or cooperative you are. So the most cooperative and assertive mode is collaboration, and the opposite to it, being uncooperative and unassertive, is avoidance. So from the 5 styles, different ones may be utilized depending on the situation and your desired outcome. So not all of the studies that used the TKI reported their individual results, but there were 2 studies that did. One of them found that accommodation, which is when you neglect your individual concerns to satisfy others, that was the preferred style in 37% of 108 fourth-year medical students. So another study found that avoidance, which is where you do not address the conflict, that was predominant in 48% of 21 radiology residents. And this trend mirrors previous research in healthcare professionals. So within the conflict management skills curriculum, there are a few skills that were taught, which I'll go through here. So one of them is open communication. It's clear, honest, and timely. That's in order to address concerns as they arise and prevent misunderstandings from escalating. As physicians, we know the importance of body language and active listening. Nonverbal cues like your eye contact and open posture convey respect, while active listening helps us understand underlying emotions. Acknowledging others' viewpoints, that's important to show you value and respect the perspectives of your colleagues, even if you don't fully agree with them. And validating viewpoints reduces tension and creates an environment where everyone feels heard. Perspective taking involves stepping into the other person's shoes and understanding their emotions and experiences, and identifying shared goals despite differences can align your efforts. So here are some outcomes from the studies that were reviewed. Based on self-reported evaluations or Likert-type questionnaires, there were improvements in areas like the participants' understanding of conflict resolution, empathy, communication skills, and the confidence they had in handling conflicts. However, some also had mixed feedback. In a medical improv program with 10 participants, they gave neutral feedback about that program's impact on their understanding of the team dynamics and conflict resolution skills. And similarly, there was no perceived change in the preparedness in the curriculum for 27 anesthesia residents. Some second-year medical students in a 6-year Australian medical program, they mentioned a limited opportunity to apply their conflict resolution skills, or that they had no benefit or low importance. So notably, the authors in that study, they mentioned that fewer clinical placements may have limited the opportunities to practice those skills and reduce their relevance to the students. The quantitative assessments showed improvements in conflict management skills. One study that used the TKI found that there was no change in the conflict handling style that occurred before and after training. So 2 control group studies found stronger conflict management skills in the trained groups, and long-term follow-up was limited to 4 studies ranging from 6 to 18 months. So the limitations of the systematic review include the lack of study and curriculum quality evaluation, heterogeneity between the studies, and the inclusion of additional instructional topics, which challenges attributing the results solely to conflict management training. In addition, many studies use single session groups and small trainee numbers, which limits the generalizability. So in conclusion, conflict management can be taught alone or with other topics such as leadership or emotional intelligence. And while early training shows promise, more research is needed to determine the most effective methods. For future directions, we need a consensus for curriculum integration, more studies with quantitative measures, and long-term follow-up, including physician wellness metrics, could also possibly clarify the impact on the physician well-being. Thank you.
Great, thank you so much, Dr. Foster. We'll now take some questions from the floor.
Thank you. I think this is really important work. In the list of skills that you mentioned there, you showed like a picture with a box. I think there was maybe 6 boxes and skills. One of the skills that I wondered about, if it was embedded in something that you had written, was about recognizing and managing your own emotions. For example, recognizing anger, how to soothe your nervous system when you're angry, recognizing when you're feeling overwhelmed or shamed, and how to soothe your system when you're that. Because I think those emotional pieces are really key to being able to apply the other skills, like, you know, taking other people's perspectives. So, because when you're emotionally dysregulated, you're not going to be able to do those other skills as well. So is that embedded in any of the training, the skills that you teach?
So the studies I looked at, that's a great question, first of all, thank you for that. The studies that I looked at, they varied. So there was a study that had simulation as well as role play. And in the simulation session, they had a standardized actor who portrayed a surgeon, and then the resident was an anesthesia resident. So the actor was actually given a cue card to either be angry or to be more subdued in the situation that they were portraying. And so ideally in conflict management, you do teach the emotional regulation as well as identifying emotions within that training. In that specific study, they didn't discuss it specifically, but they did say that residents gave feedback that in those situations, they felt their emotions were heightened when the actor was portraying they were more angry, or if they were more subdued, they were able to react a bit better. So I understand there is definitely an importance there to teach emotional regulation along with conflict management skills.
Along the lines of self-awareness, following up with that question, I'm curious if there's any emphasis on like strengths-based type of training, because as you mentioned, radiologists tend to favor one way of dealing with conflict versus medical students.
That's interesting, because I think it is important to be self-aware. There was a study that looked at the Thomas Kilmann conflict inventory, which is a way to tell you what your conflict handling style is, or what your preferred conflict handling style is. And one study found that the students who did that inventory before they learned the conflict management skills, there wasn't a change after they learned the conflict management skills. So it's not to say that one mode is better than the other, it's a matter of using them depending on that situation. So it would be interesting to see if there's any follow-up to that where they were able to broaden their perspectives in terms of what they used when they occurred with different conflicts.
Hi, thank you for that presentation. I'm wondering, in terms of the assessments that occurred after the training, if any of the assessments were by preceptors or individuals in positions of perceived power. Just wondering, because if they were trainees at the time, if there's any difference in terms of the self-assessment on the training versus observed by others that they work within the workplace.
Okay, that's a good point. There definitely can be that power balance difference where they might react differently when they know they're being observed. There were studies that did the scenario by video, so the student was there doing the role play, and then their preceptor evaluated that video afterwards. The students had also done their own self-evaluation to see, watch their video as well to see how they did, and they gave their own feedback as to what they could have done better or where they thought they did very well. So I think there were a lot of different curriculum designs in it, but that was one that kind of matched what you mentioned there.
Time for one more question?
Thank you. It was a lovely presentation. On a humorous note, as a surgically active physician, I find it fascinating that it's often the surgeon who is creating these sensations in individuals. But I wonder also if it wouldn't be of great use for eventually when we're teaching conflict skills, which I do, that we learn to handle conflicts with someone in the exact same position as ourselves, and in this way create a self-awareness of what's going on. So both that we're dealing with the person in power, but also with someone who's exactly the same as us, and not just the rotten surgeon, although the rotten surgeon should have to deal with the rotten surgeons. Have you seen any like that?
There was one situation where the role play did have two residents where they were meant to give the other person feedback. So in that situation, they had to interact, and they gave them like cues as to what they wanted them to portray, and then they would have to come into the situation and resolve the conflict, and that occurred at that time.
Great, thank you so much.